They are located in the cortical region of the lungs, especially on the upper lobes, less than 0.4 millimeters. No calcification. Yep, no calcification, just soft tissue attenuation. And we also have ground glass opacities scattered all over the parenchyma. Nothing much, just your day-to-day ground glass opacities. This is interstitial disease of some sort. This is what precedes a consolidation, or it's a edema or a infiltration of some kind of the interstitial spaces of the alveoli, the lobes, the segments, and whatnot. So this we also have on the middle lobe and on the lingula, as very commonly, also on the uppermost part of the apex of the lungs, some bands which are fibrosis, and maybe some traction bronchiectasis, which also are quite common. This patient is over 70 years of age, so it's expected. Nothing much. This is acute disease, and it has also some traces of chronic disease. Right here, just notice there is a lipoma on the subscapularis, right subscapularis muscle. I'm not going to report that because it's of non-importance in this case, but it has drawn my attention, so I'm just going to tell you guys this is a lipoma. Nothing much. Little cyst right there. The heart is clearly enlarged, especially the posterior chambers, the left ventricle, which is also quite common in this age group. Is this a enlarged lymph node? Let's measure. Short axis 1.1. Technically, it is enlarged. Could I ignore it? Yes, I could. It's not really anything much. It's probably just a reactive lymph node. There is some subcarinal lymph node right there. I guess it's going to be 1.3, maybe 1.2. Oh, this is wrong. What just happened? I didn't get. What? Right there. So 1.4 centimeters. So it's a proper enlarged subcarinal lymph node. It's worth mentioning. So let's hit D. What? Yeah. Let's see the aorta. The aorta is mildly enlarged also on the ascending segment. And of course, the root of the aorta is 4.4. It's elongated, it's tortuous, and it has also calcifications, just as we could expect. And there is also calcium plaques on the coronary arteries. So we have also to check for the adrenal glands. Adrenal glands are fine. There is some portion of the superior abdomen that has been imaged. So just going to check it out to see if there isn't much of a major disease here. So no major disease. Thyroid seems fine. So we don't have much here, but we can already report this exam. It isn't going much further than this. Just going to, I have already copy and pasted my template. I have a template for people, for old age patients, chest CT scans. So just going to report the bands and the bronchiectasis. I can really show you the report, both because it's a private information from the patient, so it's illegal to share this, and also it's all in Portuguese. Writing in Portuguese and translating it on the fly to English and the way around, so it wouldn't really matter much, but I have already reported it, the exam verbally to you guys, so let's just give me a couple of minutes for me to send this reported so we can go to the next one. So bronchiectasis and bends